Hey, it's Lacey again. I am a third-year occupational therapy student at the University of Central Arkansas, and I am creating educational videos for the community based around osteoarthritis, rheumatoid arthritis, and how occupational therapy fits into the mix. So for this video, we're going to break down the basics of osteoarthritis and rheumatoid arthritis, as well as how OT can fit into that mix. Occupational therapy. Last video we went into what was occupational therapy, as well as some of the main occupations that we'll look at throughout this video series. But I just wanted to remind you that occupational therapy is client-centered and we're occupation-focused. This means that activities that are important to you are important to us. So we can help by having education, whether that's over your condition, or even providing recommendations and different ways to do everyday tasks that make it easier for you and provide you with better function. Another way that we can help is just working with you and finding adaptations that ultimately increase your quality of life and let you do the things that you want to. So stay tuned in the series and we'll go over more.
Hey Lacey, what is arthritis?
Arthritis is simply joint pain or a joint disease. In the latest estimation, there was over 91.2 million people who suffered from arthritis. Now, I will give the disclaimer that it can affect the older population and the younger population, but we'll be focusing on adults for this video series. Arthritis is commonly broken down into two main categories. So there is the non-inflammatory arthritis, and the most common arthritis in this category is osteoarthritis. And then we have our autoimmune inflammatory arthritis, and the most common arthritis type in this one is rheumatoid arthritis. And these will be the main focus for our video series.
Hey Lacey, what's osteoarthritis?
The definition of osteoarthritis is a degenerative joint disease. This happens through a slow onset, progressively getting worse as the cartilage at the end of bones within a joint decrease over time, which can cause bone damage. This is commonly why osteoarthritis is considered a bone-on-bone arthritis. Common symptoms of osteoarthritis include pain, swelling of the affected joint, and joint tenderness. Another thing that sets osteoarthritis apart from other types of arthritis is that it can be in one side of the body or it can be in both sides of the body. Contributing factors to osteoarthritis include being of the female sex, having an advanced age, which is usually considered being over 50, having joint trauma, as well as obesity. So 40% of males and 47% of females are likely to develop osteoarthritis sometime during their life. The incidence or the likelihood increases to 60% when they have a body mass index of over 30. So when you think about osteoarthritis, a lot of people have it in different places. So the primary joints that are affected by osteoarthritis include the hands, the wrists, the hips, knees, feet, and even your spine. Depending on the severity or how bad your osteoarthritis is, it may actually involve additional joints, such as the shoulder, the elbow, and the ankles. It was actually found that 27% of osteoarthritis was reported to be in the hands.
Hey Lacey, so rheumatoid arthritis, what is that?
Rheumatoid arthritis is described as an autoimmune inflammatory arthritis. So this means that there is an excess inflammation of the joint tissue lining, which leads to tissue damage. And as this excess inflammation continues, it can lead to chronic or long-lasting pain, and it can lead to unsteadiness or a lack of balance, as well as a deformity of the joint. Common symptoms of rheumatoid arthritis include the classical symptoms of inflammation, which include pain, redness of the skin, warmth to touch, swelling, and a loss of function. These don't have to happen at the same time. Contributing factors for rheumatoid arthritis include being of the female sex, and it affects the joints bilaterally or both sides of the body. It is found that 13 to 54% of people with undifferentiated inflammatory arthritis will develop rheumatoid arthritis. If you feel like these symptoms might describe someone that you know or yourself personally, you could contact your primary care physician or the PCP and ask for a rheumatology consult. If you get this diagnosis, you're typically put on medication management, which is significantly improved over the past years. So the reason you're using medication management is to suppress inflammation, reoccurring inflammation, as well as decrease tissue damage. Thank you so much for watching the second video of my capstone series, where we broke down the basics of osteoarthritis, rheumatoid arthritis, and how OT can help. Again, throughout the series, we'll go more in depth about how occupational therapy can help osteoarthritis and rheumatoid arthritis. So keep watching. The next video, we go into arthritis, activities of daily living, and instrumental activities of daily living.